Good afternoon and welcome to United TV. This is our Bariatric Friday. My name is Kemal Erkan. I'm the chairman of American Surgery Center, #1 bariatric program in the United States. I'm here with Dr. Isaias Irgau. Dr. Irgau is our expert in the field and also our president for CHRIAS and co-chair of United Medical ACO. Dr. Irgau, how are you doing?
I'm doing great, Kemal. I know you're not doing 100% today, but thank you for sticking it out and continuing with the session today. I appreciate it.
Well, at least I'm smiling because you are here. So the earlier episode was a little bit more painful, but since you are here, so we are going to be okay. We are going to discuss two different topics today. One is just coming back from a wedding. Gastric balloon is one of the methods that we have, one of the tools that we use. This is a non-invasive, not a surgery, it's a procedure. So we're going to actually learn more about gastric balloon and who are the candidates who should be doing it, when they should be doing it, what the process is, if you can give us the background on that.
Absolutely, absolutely. So, as you mentioned, the intragastric balloon placement is one of the procedures we offer to help people lose weight. And among all the procedures that we offer, it's actually the least invasive procedure. It's least invasive because it doesn't actually involve any actual surgery where there is a cut of the skin or there is a scar, essentially, because the whole procedure is undertaken by going through the natural opening, which is our mouth, and then into the stomach. And the idea basically is to deposit inside the stomach a fairly large balloon. That's why it's called intragastric balloon. And that balloon will occupy a fair amount of the space within the stomach. And it's a fairly heavy balloon as well. And that will create a sensation of mechanical fullness, right? Typically, a person who has the balloon will feel, particularly at the beginning, as if they've had 1 or 2 Thanksgiving meals at the same time, right? So they will feel very, very full. And that's the whole idea, right? So we call it non-invasive because there's no cutting of the skin, but also it is a procedure that is completely reversible, meaning that the balloon is removed afterwards, right? In fact, the removal of the balloon is part of the whole process. The balloon cannot be left indefinitely in the stomach. And in fact, the time in which the balloon is left in the stomach is typically 6 months. So it's a non-invasive procedure, and it's also a transient procedure because it doesn't leave any permanent impact on the body from that point of view. And that is very different from the other procedures, even different from the lap band. As you know, the lap band is a procedure where we place a device, and to place the device, we actually have to cut the skin. We have to do actual surgery. And although the lap band can also be removed, and though it is a reversible procedure, the lap band actually does leave a fair amount of scar tissue inside the body. So it could not really put it in the same category as the balloon, because as I said, that with the balloon, there is no actual surgery. So what is the appeal of the balloon? Well, the appeal of the balloon is exactly the fact that it is non-invasive, the fact that it is completely reversible. But that also is the weakness of the balloon, right? Because we are doing a procedure only for a determined period of time, 6 months. And as you and I have talked many times, obesity is not a transient problem. It's a chronic disease. And who would the balloon be applicable to in that case? It's actually indicated for people who have a modest level of obesity. So it applies to people with the body mass index between 30 and 40. So we're talking about people who have class 1 and class 2 obesity, essentially. And it is to give them enough weight loss to get them motivated, but also to really help them build a pattern of eating that would hopefully keep them healthy for the rest of their life. So it is a 6 months process in that you have to put the balloon in and then remove it within 6 months. But the program that we offer in the American Surgery Center actually is a 12-month program because we enroll these patients with a monthly visit with a dietitian from month 1 all the way to month 12, which is 6 months beyond the life of the balloon itself.
So it sounds like this is the least complicated procedure, as you correctly said earlier. Because of that, its effectiveness is also not so great. But if we have the right people, right candidates, so we're not talking about someone with 52 BMI to be on the balloon. So earlier you said between 30 and 35. Like my sisters, they're watching. So before the wedding, one of them could have used this. She didn't, but she could have because she was really struggling and she was stressed out.
Mm-hmm.
But this would be perfect for her to maybe lose 15, 20 pounds, maybe even more, depending on where she is. But while you're able to do everything else and not losing any time off from work and other things, there is no wound or any clot. So it's almost like a little miracle in its own way.
It is. Actually, the weight loss can be even more substantial than that. We have actually seen patients.
Well, I didn't want to tell that my sister needs to lose 50 pounds.
That is correct. I know. Within that context, you're absolutely right. But it can be more than that. But the reason we're saying it is a fairly modest or moderate weight loss is that we're comparing it with the other procedures that we offer, like the sleeve or the gastric bypass, where we're talking about 70, 80, 100 pounds or more of weight loss, essentially, from that point of view. And then, as we said, it's a very non-invasive and safe procedure, but it does not mean that there is no potential for complications. Any intervention that we do, no matter how small intervention, always carries the potential for complications. So the indications have to be correct. They have to be the right indications. And also the risks, the benefits of the procedure have to outweigh the risks. And the risks, as I said, they're very small, but they're not zero. Clearly, there is not really very severe complications or potentially life-threatening complications in the vast majority of cases, but complications like irritation of the stomach or even ulcer formation or even bleeding can occur. In some very rare instances, people also have reported conditions such as pancreatitis that could be severe illnesses. Probably the most feared complication of the gastric balloon really is the balloon itself losing integrity and becoming deflated, becoming so small that it then can escape into the intestine, and then it can enter the intestine and cause bowel blockage that may require surgery, essentially. That risk is very, very small, but it is a risk. So whenever we offer these procedures, we've always got to make sure the patients understand what the indications are, what the benefits are, what the extent of the results are, what the commitment is, what commitment is needed for the optimal outcome, but also what the potential risks are. But still, it is a viable procedure among the different options we have to help people lose weight.
So right after the procedure, the hydration can be important. So that's also how we are prepping ourselves with these procedures. Hydration is always something that we pay attention, but with these, why would it be so important for this procedure?
Absolutely. So, in fact, the first 24, 48 hours, and in fact, sometimes even the first few days after this procedure can be challenging for the patient in terms of getting adequate hydration. And the reason for that is simple. The placement of the balloon inside the stomach creates this sudden stretching and distension of the stomach. I mentioned earlier on, it feels almost like having two Thanksgiving meals at the same time, right? Creates this discomfort, I don't feel I feel sick, I feel nauseous, I don't want to drink, I don't want to have anything to eat or drink type of situation. And with that, patients may have difficulty getting enough fluids, right? And so we emphasize this. Of course, our center has been excellent in providing us with medications that have helped us greatly mitigate this problem. Actually, many of our patients actually have gone through really well the first few days after the balloon placement because of the medications that we use. But even with those, we know that hydration in the first few days can be challenging. And in fact, we've had some patients who have come back to the American Surgery Center a day or two after the procedure, and they've had intravenous fluids to get their hydration going. So we kept patients prepared for this possibility. It's important for them to understand that, to be aware of that, and then we really educate them on different strategies to get their hydration going in the first couple of days after the procedure.
So, and at the end of 6 months, when do they know the time to take it off, or do we just schedule it?
We like to schedule it. It's actually important because sometimes patients do so well with the balloon that they don't want to let go of it, right? But it is important we tell them, because simply the balloon itself can, over time, if it overstays in the stomach, can be damaged, right, by the acids in the stomach and then lose integrity. But also the balloon itself, by staying that far out into the stomach, can potentially irritate the stomach and cause damage as well. So the guidelines that we have currently is that the balloon should be removed at the 6 months period. And obviously we schedule our patients to make sure that that happens at that time.
So in terms of the procedure itself, some of the questions I'm asking, if I don't know the process, but obviously it's just format of the show, so that I want people to make sure they understand all these questions that they may have. But one of the things that makes our practice and our center special is we are the first one who perform these procedures.
One of the first.
Yeah. But in Delaware, we are first.
Yes, definitely. In fact, we may be the only center offering it in Delaware and in our area in Delaware right now.
And because of the insurance, the way that the insurance are not covering, it didn't actually pick up as much as it should, because it's a self-pay procedure. Just knowing how much insurance are willing to spend money on the GLPs and not actually, utilizing this, that's, to me, is kind of interesting. What's your take on that?
That's a great point. Because yes, there are limitations to the gastric balloon. That's clearly, we know that the indications are also, fairly narrow in terms of who would be a good candidate for this procedure. But so are all other interventions for obesity, right? Nothing is 100%, sufficient. As we've said, we have to approach obesity in a multimodal fashion. We have to have more than one avenue to be able to tackle this chronic disease. It should not be treated any differently than a cancer, for instance, where you're okay to use chemotherapy, you're okay to use radiation therapy, you're okay to use surgery in the same patient, or in different variations and mixes of these therapeutic approaches. So to say, yes, we will pay for this procedure, we will not pay for that, makes no sense. I think the insurance companies should follow the science, right? And the science is clear. The gastric balloon has a good place, right? And given, if we use it in the right way, it does have its advantages. So it makes no sense, as you said correctly, to pay so much, for instance, for certain procedures or medications, and then deny this. So yes, it hasn't really picked up as much as it would, really, given the number of people who would be eligible for this procedure, precisely because there's that insurance authorization barrier right now. And most people have to pay out of pocket, and that obviously is a challenge for most people.
So now you talk about the 12-month process from the time of the initial balloon being inserted to the time that's taken out, the 6 months. So when does that 12 months start?
So 12 months starts right at the consultation, right? So one of the things that we do, for instance, is after we see the patients in consultation in our office, and the surgeon and the patient make a determination that the gastric balloon is an appropriate option for them, then we will send them for a nutritional counseling. So they will have extensive, evaluation and also education with the nutritionist, not only about, them knowing more about nutrition, but also to establish that relationship so that there is this ongoing sessions, throughout the 12 period of time. So it starts right at the consultation, and then there will be 12 sessions on a monthly basis after that. And clearly, this is the guideline we have, but it doesn't mean that if a patient needs to be seen twice a month, we will not be able to do that. We actually do. We're very open about our availability to counsel patients. So because we want them to be successful, we don't want lack of education or lack of counseling to be a reason for them not to succeed or to get where they need to be.
So, kind of going back to the right people, I guess a lot of the people who went through this, females, usually they have either graduation or wedding or some important holiday vacation coming. For the best outcome, what's the peak of that weight loss? Because obviously in that 6 months, they're not going to lose equal amount every month. So if someone has a wedding 3 months from now versus someone has a wedding 8 months from now, what's the best time to start for this?
I would say the person who has that 8 months window will have a better preparation. Clearly, even 3 months is a good window because although they may not complete their weight loss, a lot of the weight loss occurs very early in any type of intervention. So they will be ahead. So, if a person is looking to lose, let's say, 25 pounds, and they have 3 months, they would lose a good 15 to 20 pounds by those 3 months, and they will be very close to where they need to be. The range of weight loss obviously is variable, like any intervention, but typically the number I give patients is anywhere between 15 to 45 pounds, although we've had patients go even higher than 45 pounds as well.
I think it's a good jump start.
It is. I mean, it's interesting that, for instance, three of our patients actually were physicians.
Right. Our first one was a
Yeah.
physician.
Yeah.
And I think she was happy with the whole procedure.
Yes.
So, all right. So I'm going to take you out of our comfort zone.
Okay.
So now in this team, I'm not a licensed physician. So I specifically say not licensed. The physician part sometimes I can be, but I do not have a medical degree. So therefore I have a lot of freedom, right?
Absolutely.
So when we discuss these issues, these topics, one of the big problems that I see is sometimes how deaf people can be to the issue. In a couple of different ways. One is it may be related to them, that they don't want to hear anything. It may be related to their family, friend members, other close circle of any of their members. And when we talk about morbid obesity, issue of social stigma, issue of I want to enjoy eating a little bit more, and then I'm going to think about it later on, or I'm going to save enough money, or I don't have enough money, or I have this, I have that, so many different excuses. But one of the things that makes this program more meaningful is that we discuss and we openly talk about the struggles that everyone is going through. When I say everyone, I mean all those people that we know, although we may not met them in person, but we know who they are. And I picked a group of people for us to discuss. One of them is our good friend, Elon Musk. Now, uh, based on what I was able to find, is Elon actually is using Ozempic,
Okay.
and then he did try other medications, yet he's still struggling.
Mhm.
Now, I want to, highlight the struggle part a little bit, not because of anything, just because he's worth 400 billion
Mm.
as of this morning, yet he's not in his best shape, right? So if you have that much money, you would think that you can do anything and everything, but that doesn't happen. So, and he's struggling. So this is one of the pictures that he has when he was working out. I think it's from 2012.
Mhm.
This is when he's carrying one of his offsprings.
Mhm.
He was, I think, 15 or 20, so I did that. And he's struggling, and he's trying to pay attention, but it's still a struggle. So this is a reality. This is not a real picture, but just timing of reality, and the picture didn't go well. So and this person, you would think that he can just hire the best surgeons, plastic surgeons, this, that, and then be in best shape, and he's not. So what's your take on him and his struggle with morbid obesity?
Well, I think it really underlines a very important truth.
Mhm.
And that is, first of all, this problem is universal, right? And also the myth that it's about willpower is false, right? It cannot be about willpower, because I cannot imagine there are more people who have more willpower than somebody like Elon Musk, right? He sets out to accomplish something and he does it. And he doesn't do it because it's easy. He does it because he's good, he's persistent, and he has willpower, right? So you put that in contrast to his struggles with weight, right? Now, if it was all about willpower, he would not be struggling with weight.
Right.
And that's the key issue that it is very important to address here, that when people look at people who are struggling with obesity, particularly the ones that come to us as our patients, they look at them as failures. And patients actually internalize that feeling, and they themselves victimize themselves as well. They are ashamed of having to go to a surgeon or to a doctor to ask for help, right? Because they think, I should have been able to take care of it. Well, how do you think you would be able to take care of it if even somebody like Elon Musk is unable to overcome this? Really, that is what this underlies in my view. It really proves clearly that it's not about willpower. It's not about somebody being good at it or not. It's about a disease that is essentially biological, and something that is biologically driven is very hard to combat. Right. You could argue and say, well, but we had the same biology of people who lived 200, 300 years ago, and there was no obesity. Then yes, but we're talking about a biology within a certain environment. You cannot separate them. You cannot, we are where we are and what we do on a daily basis. Our environment is shaping us. We cannot kind of isolate ourselves from the environment, right? We are in that environment. And this environment is really very, very good for obesity to flourish. In fact, if you dig very deeply into how obesity arises, Kamal, it's actually surprising that obesity is not even worse than what it is in our society, considering how we live, right? What little activity there is and how much exposure we have in an ongoing basis, 24/7, to very, very calorie dense and nutritionally poor foodstuffs, right? And even the best among us are in this environment, and their biology cannot do anything about it except drive them and drive them and drive them, and their struggles are constant. So I really appreciate you bringing this issue, and there is nothing about shaming a person here. Really, we are bringing a fact here, the fact that even the most driven individual in our society currently, right? If you ask anyone right now, who is the most driven person in the world at the moment, I'm sure most people will say his name, right? Because of what he has been able to accomplish. And yet, I think you told me the other day that he openly, talked about his struggles with weight, right? I mean, he's not somebody who hid that, right? So that really should give comfort to people who are struggling continuously and liberate themselves from this guilt feeling, and then just go out and say, look, I need help, right? If they had diabetes, if they had colitis, if they had a gallbladder problem, they would not feel this way. They would go to a doctor and say, hey, help me fix this. And they should look at obesity in the same way as well. And this is very, very important. Now, this doesn't only translate on how society looks at it, but also it translates, for instance, to another issue that we mentioned earlier on, which is the insurers, right? There are, how many insurers you and I come across, Kemal, which say, oh, bariatric surgery, bariatrics is carved out from this plan. It's not a covered benefit. Or they would say one bariatric procedure for life. I mean, why would you castigate people into situations like that if you were not comfortable in your feeling that everybody thinks that obesity is the person's fault, right? The reality is it's not. So I'm actually happy that people like Elon Musk are coming out and talking about their struggles, because that will be really a good way for people to understand that it's not just them. Everybody is affected, but there are degrees, right? Some people, we have to look at this problem as a spectrum, right? Like any disease, Kemal, there is a mild, there is a moderate, and then there is a severe. And the ones that we are really dealing with at the moment with bariatric surgery are the ones who have severe obesity, people who, just by looking at food, their weight goes up. And yet, no matter what they do, very little happens in terms of weight loss with their constant struggles.
Yes. But our president is not in a really good shape, President-elect. And he actually is probably he's the face of McDonald's. McDonald's is getting a really good advertising these days, just like this last United Healthcare CEOs. The guy was arrested at McDonald's.
Okay, I didn't know that. Yeah. Okay.
McDonald's is everywhere.
Yeah.
And he's not a big promoter of healthy eating. What does that tell us about his health? And almost 79 right now. What do we expect from his wellness standpoint?
So I really hope he changed that stance, to tell you the truth. I really hope that he, promotes healthy eating, that he really focuses on the fact that obesity is a real problem in our society. And it cannot be left as something that is, individual choice, and therefore we shouldn't worry about it. It is, in fact, from a health point of view, many experts feel that it is probably the single most dangerous health problem we have in our society currently. And if it's not really tracked, the consequences could be so severe that the trend of increased life expectancy that we have recorded now for several decades could be reversed. And, we could have a generation now that for the first time end up living shorter years than their parents because of obesity. As we've said in this session many times, it's not just about the weight, Kemal, it's about the ravaging consequences of obesity to our metabolism, to our overall health, and to the fact that obesity is related to so many very dangerous health conditions, whether it's high blood pressure, heart disease, stroke, diabetes, sleep apnea, to just name a few, right? So it's a serious problem. And as a leader of our country, I hope that our incoming president will be able to put the right focus on this so that people can really take it very seriously as well. It cannot really help if the president doesn't really give enough weight to this issue, either by talking about eating in fast food restaurants as something normal and acceptable, or as not caring about their weight. So I really hope he changes his stance. So far, particularly in his first term, really, he hasn't paid much attention to these issues.
Well, he's the face of McDonald's. Now, just so that I'm clean, so I don't want some of his people here saying that, hey, he eats McDonald's too. Well, I shouldn't be eating McDonald's. But I also shouldn't be eating McDonald's and in this format. Promoting is one thing. Doing it, someone may smoke cigars, but they may not want to do it in front of their kids. That's because that has a different impact. Someone may be smoking cigarettes here and there, and that they may not want to do that in front of their family members. They may be drinking, and that they may not want to do it with young kids being around. So doing it is one thing, but promoting it is a major problem.
Yes, absolutely.
And so I was kind of, I'm disappointed in so many ways with Trump, but one of them is, as superficial as he is, like if he pays like 1/20th of the attention that he pays to his hair for his body, he would be in perfect shape. But promoting it this way, I think it has a lot of impact on youth, younger generation, people who may not have the same, processing, and I think that's kind of like worrying.
No question, no question. I mean, we take cues from our leaders so much, Kemal, that when we see that they're not paying attention to certain things, we are more likely to do the same as well, right? So I really hope he changes his stance, though, right? I mean, he hasn't taken office yet. This is going to be his second term. Perhaps he will have learned something from the first term, and perhaps he will want to push a different legacy, for himself and really advocate this. And I hope he talks openly about the fact that he himself needs to be, healthier, and that certain habits are not good for us, particularly fast food restaurants.
So we have another name here. This is James Corden. He's a TV host from England, I believe. So he didn't go through the bariatric surgery, but he's been struggling with his weight for a long time. I know him for a long time, like following him, just not recently, but he actually is the spokesperson for Weight Watchers.
Yes.
But clearly it didn't show the impact on him. So this is the part that they don't understand. What I was going to say earlier, this is actually not just because I'm saying it, but I think it's a good analogy for people to understand. There's this issue. We were talking about Elon Musk. So with the money that he has, he was able to get at least 5-6 different time hair transplant. And his hair looks good for where he is right now. If you check his pictures 20 years ago, he was almost bald. Now, you can fix that with adding more hair. Morbid obesity is a different story.
Yep.
So both of them are medical procedures. One does fix the problem. He doesn't have to do anything. He doesn't have to water the hair, right?
Yep.
He just needs to keep it clean. And then when it's not enough, he does another one and another one. He probably at least have 5. Like if he has full hair almost now, but he cannot fix the weight issue. So that's the part that people always need to keep in mind. So this is not a choice, or this is not, hey, I'm eating too much, or this person is eating this much. It's not about that. It's for some, it's the genetics. This should just make it very clear.
Yes.
So every time I forget, I'm just reminding myself the same thing. So this is what that is. So hopefully people can remember that. Now, this guy, James Corden, didn't go through this, he's trying different things, but he really doesn't have any choice but going through at least gastric sleeve, right?
Absolutely. I mean, I think, again, that would be currently the most successful, approach we have in bariatric surgery. But obviously, people need to be comfortable with that, right? So I'm okay for the fact that, he is waiting because it's okay, right? But the most important thing is that he is trying to address this issue. He's being open about it, and he's working with organizations like Weight Watchers, understanding that this is something that he's focused on, right? And I think that aspect is good. Now, again, it is important for people to know that bariatric surgery is available, that bariatric surgery is a very safe procedure. The safety of this procedure is comparable to things like gallbladder surgery, hysterectomy, knee replacement surgery, from which we don't shy if we are told that we need those operations, right? So this is important for people to know that. I mean, we looked at the statistics, and I sent you an article the other day, Kemal, where, the number of people, the percentage of people who have obesity in this country and who are seeking some type of treatment, whether it's medical, whether it's surgical, is actually less than 6% of the people who would need it, right? Which means that there is a huge gap in terms of education, understanding, and knowledge, right? If you take the number of people who have type 2 diabetes and you look at the percentage of the ones who are seeking treatment, the numbers are very high. As soon as you are told you have diabetes, you go to the doctor.
Right.
The ones who wouldn't go are very few, right? It should be the same for obesity as well. People should not think of it as something that has to do with their appearance, with their comfort level, physically only. It is something that has a direct impact to their health and severe consequences to their health if it's not addressed. So it is very important for them to know that they have options. So the fact that this gentleman, is struggling is really tells you the story of most people who had struggled with obesity. They try this, they try that, right? And then some reach the conclusion that, well, I need bariatric surgery, and they come to us, right? But when we look at the number of people who actually seek bariatric surgery, it's a tiny fraction of the people who really would benefit from bariatric surgery. So having this discussion is having people like this gentleman talk about it openly is actually very, very helpful when you look at it in the big scheme of things.
Just having the recent family emergency and going through a lot of things firsthand, I was always thinking, what if she was much heavier than she is right now? How would we take care of her? I mean,
Absolutely.
right? This was a heart surgery. So this could be other surgeries, orthopedics, anything that unexpected. When you are not ready, it's a huge struggle.
Absolutely.
And every day when we have to lift my mom, I'm so glad she's not so heavy.
Yeah.
I mean, she's still not the skinniest person, but we were able to handle it. But because it's me, like maybe I'm more powerful than the nurse who's taking care of her or my sisters, but if I'm not there, they're doing it.
Absolutely.
So the recovery of any type of other procedures later on in life, that's why I think someone like Elon Musk should be prepping better for those types. Anything can happen. Like if something happens to Trump today, his recovery is not going to be as quick. And those are the things that we are actually looking for. It's not a cosmetic surgery. It's the life itself. The things can come out from nowhere. That's what happened to my mom. I went there for a wedding, ended up having my mom having a triple bypass. Emergency. There's no like a bariatric 3 months prep.
Right.
So we had to go there Tuesday night, Thursday morning, there was a surgery. So you don't have time for anything. You don't have time to prep for anything. The only prep that you can have, whatever you have done in your life until that point. So this is why, it can become really personal, but making sure that people understand this is not about how you look, it's about your health, your well-being. So that's why we are also bringing these individuals so that people can see that this is everyone's struggle. This is happening day to day to rich, poor, men, women, whatever you have out there is happening to those. So that's why we want to make sure that these episodes can actually reach out to those people and then make them understand what may be coming to their way.
Yeah, I mean, and you bring up a very important aspect of obesity that we actually don't talk about very much, and that is the risks of any type of surgery when the person is morbidly obese, right? They skyrocket, whether it's anesthetic risks, for instance. We always talk about, for instance, difficult airways, right? Meaning that the anesthesiologist having a hard time placing a breathing tube on somebody who is morbidly obese, right? That by itself is a big risk. The surgery itself can be much more complicated if the person is morbidly obese. And I'm talking about any type of surgery. The healing period could be hampered because being morbidly obese is like being in a constant state of inflammation, right? Where the body is just not well, which means that healing doesn't occur well. The immune system doesn't work as well. So it creates so many disadvantages for the body, so that if an emergency procedure is needed, the risks are higher immediately just because the person is morbidly obese. So you're absolutely right. It is very important to really know and understand. It's not just about, I cannot fit into these clothes that I like to fit in, or I cannot tie my shoes the way I used to do before. Yes, those are also great, problems in the quality of life, but much greater than that are these real illnesses and real health risks that morbid obesity comes with.
Absolutely. Well, Dr. Irgau, thank you again.
Okay.
Today we try to cover a gastric balloon procedure, as well as the some of the public figures who are having weight issues and struggling with morbid obesity, and they do discuss these publicly. That's why I was able to pick those individuals. So we were not trying to target them, but more about, since they're able to talk about these, so then I felt more comfortable to bring those names up, and more relatable in some ways. We can multiply those examples with so many different names, but morbid obesity is real. Your life is extremely important. So you want to enjoy your life. You want to prep yourself for what may be coming to your way, and just enjoy the life. So that's why we are here. So hopefully we were able to provide the information that you were looking for. And again, I apologize for the voice. So coming down with some cold or something, but hopefully I will make use of it, Dr. Now. So hopefully I'll be better next week. So we'll see you guys soon.